I'm here again today with Bonny Specker, epidemiologist from South Dakota State University, who is going to talk to us about what's going on with COVID-19 in our area and in the world. And also today she's going to give us a mini lesson on what does it mean to be recovered from COVID-19. Bonny, what does that phrase mean?
Well, it depends on what you look at. The dashboard that the Department of Health has provides enough information to make this graph. This is a graph that's included in those daily updates. And in this graph, we show the number of active cases, which are still increasing, but we also have these recovered cases. And some people think that this means recovered, but I thought it would be good to go over what the actual definition of recovered is on that website. Both the Department of Health and the CDC have a pretty strict definition of recovered, and that's that you're at least 10 days out since your symptoms started, and that there's at least 24 hours have passed since your fever went away, and also that other symptoms have improved. So if you're still in the hospital and you're, say, 2 weeks out, but you're in the hospital, you wouldn't be considered recovered because your symptoms are still bad enough to keep you hospitalized. But if you had multiple symptoms and they've gotten better, but you still have some of them, so you're not completely recovered, according to this definition, you would be considered recovered. And there's now some evidence out there about this term long COVID, and people are using it to describe people that have recovered from COVID but are still showing some sort of lasting symptoms or effects. And it also describes those people who have had the usual symptoms far longer than what would be expected. Now, there are some studies suggesting that this long COVID does exist, and probably one of the most important ones, or the best of the studies, is a study of hospitalized COVID patients 60 days after their first symptom. This paper is reported in the Journal of the Medical Association, the American Medical Association, JAMA. It's a study that was completed in Italy with 143 people, and they had a mean hospitalization period of close to 2 weeks. It is a peer-reviewed scientific journal, which gives it some more credibility than articles that are not peer-reviewed. But that particular study found that 2 months out, 13% of these patients were free of symptoms, but 87 of them were still experiencing at least one symptom. 32% of them had 1 to 2 symptoms, and 55% had 3 or more symptoms. So this is 2 months out, and by definition, these people would have been recovered according to that CDC definition, but you can see that they do have persistent symptoms. In this same study, these patients, none of them had fever or any other signs or symptoms of that acute illness that you see when you first get the virus. And the most common symptoms that were reported was fatigue by 53% of the people, loss of taste or smell, joint pain, chest pain. 40% of the people actually reported a worsened quality of life. So their quality of life was not good. There's another study out there called the UK COVID symptom study. And this study's a little bit different in that it is using an app that tracks symptoms. And people in the UK, Sweden, and the US have this app on their phone, and they record how many or what symptoms they have each day. So it's not quite as strong of a study because who is it that gets this app? There's what we call, there could be a selection bias in that. This was published just this last week, but it has not yet been peer reviewed. So it's a very preliminary study. But this particular study found that close to 87% of individuals had symptoms for 4 weeks or less. 13% had symptoms for more than 4 weeks. 4.5% had symptoms for more than 8 weeks, and 2.3% had symptoms for more than 12 weeks. So that adds up to more than 100, because that 13.3 includes the 8 and 12 week individuals as well. The symptoms in this study, that the most common ones were fatigue, headache, shortness of breath, loss of smell, and a persistent cough. Now there's a couple other studies that are out there. There's one that was done in the Netherlands and Belgium that looked at both hospitalized and non-hospitalized individuals who reported multiple symptoms 3 months out after the onset of infection-related symptoms. And then another study out of France looking at, again, hospitalized patients, and they had symptoms almost 4 months out, including fatigue, difficulty breathing, loss of memory, concentration issue, that brain fog that people you might read about in the newspaper, and then also sleep disorders. And just a reminder, back in April, Chelsea, we did that one talk on the cardiac, long-term possible cardiac effects. So we've talked about that before, and the video is on the city website. But in summary, this COVID is a new disease, and we're still learning a lot about it. Some of the studies about the long COVID are preliminary, and based on these select populations are relatively small sample sizes. And we really need further studies to determine when people actually recovered from COVID, and why do we have what appears to be long-lasting symptoms or effects from being infected with this virus. For many people, it does appear that it is much longer than just 10 days after the first appearance of symptoms that they still do not feel 100% better. So it does appear that there may be something with this long COVID, but we're just not sure at this point in time how serious it is.